Imagine you have a patient who had a MitraClip procedure and now has recurrent or persistent mitral regurgitation. What can we do for that patient? This article examines a large series of reoperations after failed MitraClip. I am Dr. Juan Cristanello, and this is the cardiovascular surgery series. I will discuss today mitral valve surgery after failed transcatheter edge-to-edge repair. We operated on 41 patients after failed MitraClip procedure. Patients were elderly and high-risk surgical candidates with a predicted risk of operative mortality of 9.4%. Half of them had previous cardiac surgery. Operations were performed a median of 8 months after the MitraClip procedure. All patients had mitral valve replacement. 3/4 of the patients had concomitant surgical procedures. Operative mortality was half of predicted, and 1-year survival was 79%. Outcomes were similar in primary versus reoperative cases. We conclude that mitral valve replacement can be performed safely after failed transcatheter edge-to-edge therapy, with operative mortality lower than expected, even in high-risk patients. Thank you for listening to the cardiovascular surgery series.